If you are watching this with a thumping pain in the back of your jaw, or you are finding it difficult to even open your mouth, you are dealing with the physical consequences of an ancient biological flaw. Thousands of years ago, our prehistoric ancestors heavily relied on a coarse diet of raw plants and meat. To grind that tough food down, they required a large, robust set of third molars. But as early humans mastered fire and began cooking their meals, food became significantly softer. Over millennia, the human jaw slowly shrank in response to this easier diet. But while our jaws got smaller, those third molars, what we call wisdom teeth, stuck around. Because there is no longer enough room for them to properly erupt, these vestigial teeth often become impacted. This means they remain trapped beneath the gum line or grow at an angle, wedging tightly against the adjacent teeth. Over the next 6 minutes, we will diagnose exactly what is happening in the back of your mouth, and then execute a strict 3-step immediate care routine to neutralize the pain and swelling. Recognizing the evolutionary origin of this structural trap is the first step. Now we can physically assess the site and manage the inflammatory symptoms. Step 1 is the physical self-assessment. Before we begin, wash your hands with soap and water and position yourself in front of a bright, focused light source. You will need to gather a few items for this routine: salt, warm water, an alcohol-free mouthwash, anti-inflammatory pain relievers like ibuprofen, an ice pack, and a hand mirror. Open your mouth and use your mirror to inspect the gum tissue over that back tooth. You are looking for a fleshy flap of gum partially covering the trapped crown of the wisdom tooth. This flap is called the operculum. Because the operculum creates a small, dark pocket over the tooth, food debris and bacteria easily collect underneath it. This causes a localized inflammatory condition known as pericoronitis. Look closely at the site for redness and localized swelling, and note if you are experiencing an unpleasant taste or bad breath. These are clear signs of trapped bacterial buildup. You might also be experiencing trismus, a condition where your mouth opening is severely limited. This occurs because the infection has irritated the surrounding jaw musculature, causing it to stiffen in response to the trauma. Confirming these localized symptoms means you have identified a pericoronal infection. To stop the pain, we must immediately deploy chemical and mechanical methods to clear the site. Now that we have identified the exact site, our goal is to breach that debris pocket and starve the bacterial colony causing your inflammation. Step 2. Make absolutely sure this mouthwash is alcohol-free. Alcohol-based rinses will chemically burn the already irritated tissue, causing further inflammation and worsening your pain. Consistent, gentle flushing keeps the pocket clean and prevents the bacterial infection from expanding outward into deeper facial tissues. With the area cleaned, move directly to Step 3, pain and swelling management through pharmacological and physical means. Take an over-the-counter NSAID, like ibuprofen or acetaminophen, adhering to the package instructions. These medications actively suppress the body's aggressive inflammatory response from the inside out. Next, direct your attention to the exterior swelling. Wrap an ice pack in a clean towel and apply it firmly against the side of your face. Institute the 20-20 rule for this cold therapy. Keep the ice pack on your face for 20 minutes, then remove it for 20 minutes. This cycle safely reduces facial edema, or fluid swelling, without damaging your skin. These steps work in tandem. While the oral medication blocks chemical pain signals, the cold therapy constricts local blood vessels, physically dampening the throbbing sensation in your jaw. This two-front blockade provides a critical window of comfort, keeping your symptoms strictly managed while you await a professional surgical evaluation. While your symptoms are manageable right now, this home care routine is only a temporary holding action against a recurring anatomical issue. Your oral surgeon must perform a radiographic examination using X-rays or a CT scan to accurately map the tooth's position. Based on those images, the surgeon will present the primary management paths: extracting the complete tooth, partially removing the tooth, or engaging in active surveillance. We see the definition of partial removal, specifically known as a coronectomy. A coronectomy is a surgical procedure where only the crown of the tooth is removed. The root and associated nerve complex are left intact to avoid injury to the inferior alveolar nerve. Alternatively, if the teeth are completely asymptomatic, the surgeon may select active surveillance. This means leaving the teeth in place, but requiring annual dental checkups and updated X-rays to monitor the site for negative changes over time. Only a professional medical evaluation can determine which surgical strategy will permanently resolve the ancient evolutionary mismatch of your third molars. There is a strict boundary between a manageable infection and a medical emergency. You must monitor yourself for a systemic breach, which occurs when a localized infection spreads into the deep fascial spaces of the head and neck. These are your absolute emergency red flags. If you experience a fever over 102 degrees Fahrenheit, any difficulty breathing or swallowing, or see visible pus draining from the site, you need to seek immediate medical attention. Left untreated, these spreading infections can cause severe airway obstruction or life-threatening systemic sepsis. Your final directive is crystal clear. Use the flush protocol and cold therapy to manage your acute facial swelling today, but secure a professional dental appointment tomorrow to prevent a systemic crisis. Once your extraction or coronectomy is eventually performed, be absolutely sure to follow all post-operative instructions provided by your surgeon. Understanding exactly why your jaw hurts gives you the power to treat it. With intellectual preparedness and swift, tactical home care, you can successfully navigate the ancient biological trap of your wisdom teeth.